As most of you know, whether you're in DC or you're in a rural area or on tribal lands, it's hard to get to services and receive services if you aren't moving. And if you don't have a car, if you have low vision or a disability, or you have a temporary disability, it doesn't matter. If you're not able to move, you don't get the services. And what we do is we look for ways to connect the public health and the employment and all of the different services that people need to the wheels. And that happened in a bunch of different ways during the pandemic by flipping the dialogue. Many tribes shut down entirely to protect their tribal health, and others didn't, and lost many people. And it was very, very difficult. And it was difficult for rural communities and for tribal communities nationally. But many of the transit people, they are frontline workers. They got on the vehicle, they helped people access food and medical care throughout the pandemic. And I just was at a national conference where we were talking about the value of the frontline workers and the transit heroes who I know brought food, innovated. One program I work with up in the Nut Lake Band of Chippewa, they instituted 3 new programs during the pandemic. And one was to turn a beyond useful life vehicle into a mobile food shelf so they could deliver food to people rather than requiring people to come and get food. So another was a van share program with accessible vans that you could have volunteers trained to, or your family member trained to drive that vehicle and make sure that a person who needed dialysis or was in a wheelchair could access their care that they needed. And then the other one was a volunteer program to connect with a healthcare center. And what I heard at the conference I was at this past week is that the rural transit people are ready and willing in any way they can to coordinate with the public health people to get people to their vaccines. And the issues that we're talking about for Thanksgiving and around the table, that is like the microcosm of systems where you had drivers who didn't want to get vaccinated. And you have situations where people, there's a higher rate of driver assaults and confrontations because people don't want to wear masks. And the drivers are the front line saying, if you want to get on the bus, you have to wear a mask. So our program is here to support that and disseminate information into the communities and provide a forum for rural and tribal operators and for states to talk about and look for ways to nationalize strategies for helping people access vaccines, access healthcare, access food, maintain some level of capacity during this time. And it's over, I think it's over 600 transit drivers died of COVID. It isn't, it isn't just one part of our community, whether rural or urban, that has been hit by this. And I have to say that within our program, my team basically went remote, but then I am in DC with Nellie, and we were able to do that easily. And there's 2 of us. Up in Boston, I found out late that, they had been getting pressure to come into the office. What? So I think that I've found during this that there is a need to advocate and model behavior. It's not just that here are the things that we need to do, but also we need to do them in these places so that we are wearing masks when we go out. We are modeling that behavior when we are in groups, or we're avoiding being in the groups. I did a presentation with the National Association of Drug Court Professionals with one of the White House Office of National Drug Policy Control. And she wasn't allowed to be in a room with more than 50 people. We, at our conference this last week, FTA, the Federal Transit Administration, was not there. They were all remote, and they have been remote since last March and have not been to meetings or in their offices. So in many ways, I think the Federal Transit Administration is modeling safer behavior so that they're not getting workplace transmission. And we, in our program, have tried to model that same behavior. When we go to conferences, we social distance, we wear masks, and we're here to help. You know, one of the things that we run into is people who aren't part of the transit world don't understand how to talk to transit people, because transit people want to know things like how many people, where, and when. And many times if you're not in transit, you just think, well, we need more access. We need more trips. We need more vehicles. So I'm here to listen to you and to be a resource and let you know that if any of your organizations are trying to look for ways to work with transit, we want to help systems all over the country, which we work with, understand how to work with you too. So, I mean, it's many, many layers, but there are some real points of light and some opportunities that are being expanded upon, and they're working. So right now there's a project called the PICK project, P-I-C-K, and it's in Oklahoma, and it's 21 counties. It's being led by the Cherokee Nation. Kendra McGeady is the transit manager for that group. But actually two other of one of our board members and a former board member are also participating in it. And they all provide demand responsive transportation in highly rural areas. And they're coordinating through Uber with their route match partners to get the local demand response services in that 21 county area visible on the Uber app, or people can call to set up those rides. And I think that there is no one answer. Transit is a reflection of the values of and the identified needs in a community. So in many places that are very conservative, you have very good transit. In many places that are very rural, you have very good transit. But if someone hasn't been that champion, if someone hasn't made those connections, then oftentimes it doesn't happen. I was just at the conference with the New Mexico DOT, and they were talking about how exciting it was that the Navajo Transit had moved into the Navajo DOT. So it's moved into the Department of Transportation on the DOT reservation, the tribal DOT. And so now they're working in a much more effective way to get the transportation out and coordinate in the region, because as Loris knows, the Hopi have their own, the Hopi Senum have their own transit, and they have dealt with terrible issues during the pandemic. And Donovan, who is the transit manager there, he has actually been ill. And the other people in, huge, as Melissa was saying, the attrition rate with the Navajo people has been horrifying. And I know other tribal places where they've shut down, but the effect this is having all over the country is people are looking for smaller vehicles, more access to a more distributed mobility. And so I think that this is an opportunity for people to connect in. I know the people in Nebraska, and I've worked quite a bit with their different programs. So I really, they are like hidden gems. If any of you are looking to see where the programs are in the country, you can go to the National Transit Map. And that shows where they are. And there are opportunities by contacting us. We can connect you with the most local transit, or we can get you to the people that can connect you with those things. And you know, like any relationship, it isn't one and done. It's, you have to develop that relationship. You have to share, and you have to develop the trust and understanding, because transportation, all the money for transportation flows through planning. And so something can be very important, but unless it's in a plan, the transportation people can't see it and they can't fund it. And so like with this, what's happening in Omaha, you could, so there's 80 out, so there's different ways that you can get free public transportation depending on how the plan is in your local community. So in Omaha, if they have 80 hours that they're able to put into moving their local officials around on the transit buses, but any qualified human service organization, which includes any of the health organizations, is able to work with the transit program to provide more specialized program access. But that depends on them knowing that you need it, or that they have in their plan kind of a clause for other opportunities as identified. And I've worked with rural areas where they do that. That's what they put in there so that they can know, oh, we're going to go to the fair, or we're going to go to the bird festival. So when you are thinking about putting together an opportunity for vaccination or health access, just calling up the transit operator and asking them, telling them what you're doing, bringing them in. As you're planning it, just sort of seeing that as a factor, that gives them a chance to really be there. But the fact is that Omaha has a fairly good transportation system, and they have been very open to working with us when we've been in town. So I would be happy to work with you offline, but any of you who are on and are looking for opportunities to connect, we're happy to help you make those connections.